Hello, and welcome to the Stem Cell Healing Institute podcast. In case you have any questions regarding this program, please write us at info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello and welcome back to the Stem Cell Healing Institute podcast. We are here with Dr. Sara Figueredo. She is the research and general director of the institute, and we have a very interesting topic today. But before I go any longer, I want to introduce the doctor. Doctor, how are you today?
I'm very well, Luis. Thank you. How are you?
I'm doing fine. Looking forward for the weekend.
Yes, same here.
So today, like I said, we were gonna have an interesting topic. Well, the first part is, of course, for the women out there, and that is about the vaginal rejuvenation and how the stem cells can help. Then we also gonna speak about the erectile dysfunction and how stem cells can help as well. So, doctor, why don't you start with the first topic with the vaginal rejuvenation and how can women can get a benefit with the stem cells?
Yes, Luis. Basically, let's talk about what happens, or what causes sort of deterioration of the vaginal area. So various different causes such as diabetes, endometriosis, of course, childbirth, and aging, just typical, just common, the aging and wearing and tearing process, as well as the laxity in the muscles just from age as well. And so we have various different causes of vaginal deterioration. And now what the stem cells can do is literally go in, as I've spoken in the past about, regeneration by the stem cells. So regeneration, reconstruction, rejuvenation. And basically what we do is we go in with stem cells and growth factors. The area is numbed, and we do sort of an intra and extravaginal injection. And that means that it's along the vaginal lining and the vaginal wall, as well as the cervix if it requires, and as well as sort of the outer area, the vulva area and the clitoral area, where there can be either damage or just wearing of that area. And what that does is and it helps in the muscles as well. We inject the muscles so that women can have, it's in intimacy, it is much more comfortable. So women that are in pain from intimacy, as well as ones that don't experience an orgasm, what happens is it heightens the experience in every way. And so it's a very sort of all-in-one treatment in order to rejuvenate the area, enhance intimacy, and as well as lubrication. And as for those women that are in peri and postmenopausal stages of their life, it's a very, very improvement in the quality of life in that aspect.
May I ask you, can this actually help also to stop incontinence problem for women
Yes.
that have that issue?
Yes, absolutely. That is a very good question, Luis, because the same muscles are used when women and men, when they do a Kegel exercise, which is when it's the contraction of the muscles in stopping the flow of urine. That's a Kegel exercise, and it's using those muscles not only for orgasm, but also for urinating. And so when those muscles are strengthened, it helps in both the incontinence as well as heightened experience during climax.
So, doctor, can this actually avoid surgery for these that well, women usually get a surgery for this procedure, but can actually stem cells replace the surgery?
Yes, yes, and it depends on what they're having the surgery for, but absolutely, there really isn't much of a surgery except for going in and tightening the area, the vaginal wall, if it's extremely lax or flaccid. Um, this does a better job because of the fact that the stem cells go in and not only rejuvenate the vaginal wall and the laxity, but also the clitoral area, the vulva area, and the G spot area, which literally enhances sensitivity and enhances uh, uh, basically sensitivity during a climax.
So there you have it. If you want to get the stem cells for this problem, you can contact us, but we will give up the information by the end of the podcast. Right now, we will speak about erectile dysfunction for all the guys out there and how the stem cells can help. So this podcast is actually for both of you.
That's right. We don't want to forget the males. So yes, erectile dysfunction. We'll talk about causes again to begin with. So erectile dysfunction can be caused by either physical injury to the groin area, or which could cause a damage in to the nerve itself. It can be caused by circulatory problems, so high cholesterol, advanced age as well, blockage of arteries, as well as diabetes, which affects the circulation. So there are various causes of erectile dysfunction, and we have to remember that injecting the area and enhancing it physically will get us, it'll get us to a certain point, but we also have to remember that there are psychological aspects of erectile dysfunction as well, that we need to address because
I
the
was just gonna say that as a male, I know the emotional part can also influence the erectile dysfunction, right, doctor?
Yes, absolutely. And the same goes for women as well. If they're, the emotional and psychological aspects are affected, then it's difficult for a woman to get aroused also. So this plays a role in, of course, both sexes. And with men, because the anatomy is so important in terms of intimacy. It plays a huge role in that we have to ensure that the psychological and emotional aspects are addressed along with all the physical. So making sure the nerve is not damaged, making sure there's proper circulation, um, even proper nutrition, and so on and so forth. So yes, there are these both of these factors are at play. And with the stem cells, basically what we do on the male side of things is we inject into the muscles of the groin, as well as around the nerves if there's nerve damage, the corpus cavernosum, which all is affected in terms of dilation of the blood vessels when there is an erection, in order to have an erection. And so all of these areas are addressed and with the stem cells in order to have the best possible results. And of course, this is done under anesthetic. So a lot of you are probably cringing out there as to, thinking about a needle in that area. But
Yeah, for sure. I was just gonna ask you that.
so it's all done under a local anesthesia. In some cases, a sedative, a conscious sedation,
Yeah,
depending on the
because
patient.
both treatments that you just spoke about, I was just wondering where did you actually inject the stem cells? But yeah, if you place the local anesthesia, that will solve it. Can also the erectile dysfunction be caused by obesity?
Yes, yes, and that will be affected by just the obesity itself, and it's very, very common also that obese obesity can result in diabetes. So it's sort of a vicious cycle, and it almost goes hand in hand. And so everything has to be addressed in terms of blood sugar and nutrition, the proper nutrition, and weight management as well.
Doctor, as far as the vaginal rejuvenation and also the erectile dysfunction, when can we start seeing some improvement on that, on the stem cells that are actually taking effect on the patient?
Yes, that is a very good question, Louise. So, as I say, typically, to really see the full extent of the results, or almost the full extent, we require 2 to 3 months. Okay, because regeneration takes time, and it has taken time to get to this point of degeneration and dysfunction. So regeneration with the stem cells takes time because we're literally going in and reconstructing, and that doesn't happen overnight. And of course, during the healing process, after the injections, I've seen women have results within weeks. That could be about the soonest that we actually start to see results is within weeks, several weeks. But to see the full extent, and even for men, the same is the same. We've seen results after weeks. But to see the full extent of the results, we require several months in order to see how that part of the anatomy has been affected by the stem cells.
But this treatment will have to be addressed with another treatment, I suppose, a pre-treatment, in order to get the stem cells to do the work.
Yes, that's right, Louise. Yes. So what we do, which is very comprehensive, is we do a pre-treatment protocol, which is we start about a month before the patient comes to our clinic for treatment. We start with key nutritional supplements, as well as certain key antioxidants, key dietary changes, key lifestyle changes, stress, exercise, things like that, and nothing that's not sustainable. Depending on the patient and on an individual basis, we give the recommendations accordingly. And then once the patient comes to our clinic, we will do sort of again, right before the stem cell treatment, a few days before, we start growth hormone therapy. We start any other kind of hormone therapy that needs to be addressed. And that was something I failed to mention, is that erectile dysfunction as well as female sexual dysfunction can be caused also by a hormone imbalance of the female and the male respectively. So that is something that we address also. It's really important that we do this screening and get blood tests beforehand also. So we don't leave any stones unturned whatsoever. It's really important to treat every condition in a very complete, comprehensive manner, as opposed to just a one-shot deal and hope that the stem cells work. So we'll start that type of a hormone therapy. We also start oxygen therapy, which helps the whole body as well as that part of the anatomy to get ready for the stem cells, prepare for the stem cells, and also prepare the stem cells themselves if we choose to use autologous or self stem cells. And last but not least, we use a stem cell enhancement formula to, again, sort of prepare the body, prepare the stem cells, and keep the stem cells going once they're deployed into the body. And that just entails a combination of key minerals, and that and the growth hormone therapy and any other hormone therapy will last several months, if not indefinite.
Doctor, I would love to ask you, what is the process of evaluating a patient before they come to your clinic? Do they have to come beforehand, or can you do it remotely?
Louise, this is a very good question that we haven't discussed in depth. I know I've touched on it in a few of the podcasts, but I'm really glad that you asked me, because it's really important that patients understand. First of all, there is an approval process for each patient, okay? Because not every patient is a candidate for stem cell treatment. So there is an approval and screening process. Now, in that screening / evaluation entails a thorough medical history, where myself or one of the other doctors will sit down on a Zoom call uh, with the patient and get ask a series of questions and get a really good thorough history. That can take an hour to an hour and a half, and then after the intake, we will deduce which blood tests we need to see prior to approval, and we send a list of blood tests that are required for the blood work in order to get the final approval. And once everything checks out, we will send an approval letter, and that just means that officially the patient has been approved. And if they choose to proceed with treatment, we would do so at that point. And the evaluation and approval process, there is no obligation whatsoever. So in the process of getting approved and receiving approval, it doesn't cost the patient a dime to do that. It's really important on our side for us to ensure that the patient is well enough to receive treatment if they so choose. And we take it from there. And of course, this is all really important to do prior to the patient coming all the way to Guatemala, because we don't want them to come and then we decide through the approval process that the patient is not suitable for treatment, and then they're denied, and then they go back without treatment after having come all that way. So that's pretty much the process in a nutshell.
Well, that's good. It's good that we cleared that up, because if you do want to come to Guatemala to these stem cell treatments, so there you have it. We will do all the screening and all the tests remotely. I mean, you will have to do them yourself, but we will tell you what test you needs to be done, so you can comfortably come to Guatemala and do the stem cell treatment with Dr. Sarah Figueredo. Doctor, is there anything else you would like to add to this podcast?
No, I think it was a pretty complete podcast for a Friday afternoon, Louise. I will just end with our contact information. If there's anyone out there that wants to reach us for more information, they can email us at info@stemcellhealinginstitute.com. They can also reach us by WhatsApp at +502 42207297, by phone at 209-690-7836. That's a North American number. And they can also visit us on our website at www.stemcellhealinginstitute.com or stemxcure.com, and visit us on Facebook, Instagram, Anchor, as well as Spotify, and our YouTube channel for these podcasts and videos.
Excellent, doctor. There you have it, folks. Now you know how to get, well, you can improve your sex life by doing a stem cell treatment. Thank you, doctor. You have a wonderful weekend, and we'll see you on the next podcast.
Thank you so much, Louise. You do the same. Take care.
Take care. Bye-bye.